Thank you, Emily. Whoops. Here we are. So these are three really good papers, very clearly presented. They're producing new evidence that is really important, it seems to me, particularly for policy purposes. Just to summarize them, Ludovico's presentation demonstrated that reform in one policy area, in this case, policy on the basic state pension, could have implications for a completely separate area of policy. This is care for disabled people. And this impact is remarkably large. So there's the reform that delays women's take-up of the basic state pension induces a substitution of paid work for informal care, which reduces the delivery of informal care. And the figure here is something like a 10% increase in working hours leads to a 3.7% fall in care hours, an elasticity of about 0.4. And what's more, there's no evidence of a compensating rise in other care types. So the recipients of this informal care appear to be suffering as a consequence of this pension reform. The second presentation from Kelly is looking at the COVID-19 lockdown, and the authors here find that there is a worse impact on the mental health of carers than non-carers, and the impact is especially serious for carers of children, especially also people with learning difficulties. The intriguing thing, which is not yet possible to answer, is the question of how persistent these impacts will be if and when normality returns. Obviously, we're still living in the short term, but there is potential for quite long-term impacts to continue. The third presentation from Ursula Hentz is looking at informal care and perceived relationship quality, and produces findings that surprised me. They're not at all what I expected. The first is that there seems to be no really substantial association between care on the one hand and relationship satisfaction. But on the other hand, there is, it appears, a loss of perceptions of cohesiveness of the couple, which is linked particularly to intensive caregiving. Now, what I'm going to do is just talk about a couple of thoughts that occurred to me about these three presentations, which connect some of them together. And then I'll end by just making a few remarks about policy, not specifically the policy implications of these particular studies, but policy in general. The first theme, which I think is common to Ludovico's work on the pension reform, and also Ursula's analysis of the links between caregiving and relationship quality, is about how we think about these kind of things. These two studies are demonstrating the existence of links, and they do so very powerfully, I think. We tend to think in terms of one thing having an impact on another thing. An awful lot of applied work proceeds in that sort of framework. And we then worry about causality, which leads to techniques like instrumental variables and so on. There is a question, though, about what this kind of view of causality of one thing having an impact on another actually means in some contexts. To take the example of Ludovico's analysis, the context is that we have caregiving working hours and then as a consequence of working hours, also income. Those three things are joint outcomes of a decision made within constraints. So these are decisions about how to use their time being made by the daughters of people who receive informal care from them. Now, the thing about the change in the state pension age is that it changed the opportunity set. It changed the set of things that these daughters were able to do. They could still give up work, but they would lose income. Or they could continue working and they would have less time available for supplying care. Now, the change in the opportunity set caused by this reform has a behavioural response. So it changes the allocation of time to caregiving and paid work, and it also changes the daughter's income. Now, since caregiving and paid work are joint outcomes of the same decision, it's not at all clear to me what is the real meaning of the causal impact of work hours on caregiving. And you might think of a parallel with demand analysis. In standard economics, you have consumers who spend their money with a budget constraint and they have different prices for different goods. And we end up with demand relationships, relating demand to prices and income. We never, in that context, ask what is the causal impact of increased demand for bread, say, on the demand for fish. So, and similarly, we have, in this case, a joint decision about caregiving and working. Should we think, rather than the impact of working on caregiving, should we think more deeply about the change in the opportunity set caused by the alteration of the state pension age and how that simultaneously changed both of the outcomes? There is possibly a similar question with Ursula's analysis. She is looking at the impact of caregiving on relationship quality. It's possible to argue, I suppose, that relationship quality and caregiving are both joint outcomes of some deeper domestic process that operates over time and which becomes disrupted at some point by the disability of one of the partners. And then it's a question of exactly how these two things jointly are being disrupted by the development of disability. However, it may not matter very much. The general conclusions are what's important here. And the conclusion from Ludovico's work is very clear that this pension reform had a big, probably unintended impact on caregiving. And in Ursula's case, that there fortunately doesn't seem to be much relationship between caregiving and satisfaction with relationship quality, but there is this intriguing loss of cohesion there. So the general conclusions I don't have any arguments about, but I think there are interesting questions to ask about the way to think about these relationships. A second obvious theme that links all of these presentations together is spillovers or connections or links. We tend to compartmentalize ourselves in terms of both research and particularly policy. And this often seems to be quite a big mistake. And these three papers are all demonstrating the importance of links between otherwise disparate things. So in Ludovico's case, for example, we have pension rules, pension policy. Changes in those rules affect the incentives for women to work, which then also at the same time changes the incentives to supply informal care. It may also change other incentives too, incentives to take up public disability support. It may also change the eligibility for local authority funded care, since local authorities are allowed to take into account the availability of informal support. In Kelly's case, the spillover, the link is between COVID, which is a sort of standard public health medical issue, which brought forth quite a radical public health response. But then there is this spillover into mental health, and there is the question of whether the response to medical health problems will be as radical as the public health response was. And then in Ursula's case, there is this issue of caregiving by partners and the loss of marital cohesion. So marital quality and caregiving are two different things, but they're clearly linked by this family context. But there are lots of questions that come up. Caregiving, particularly extensive caregiving for a lot of hours, is a pretty good proxy for the severity of disability. And so the natural question is whether this loss of marital cohesion is something to do with the caregiving, or whether it's something to do with the nature of the disability. Is it just less possible to do this kind of common planning, joint activity and so on when disability is as extensive as that? And finally, and linked to this whole spillovers issue, is policy. A few years ago, probably more than a decade ago now, people talked an awful lot, people in government talked an awful lot about joined up policy. It's gone a little more quiet on the joined up policy front in the last few years. But this is obviously an important issue. Research is showing up these links between distinct outcomes. And yet the institutional policy setup doesn't really reflect that. So, for example, 3 years ago, I think the Department of Health became the Department of Health and Social Care. A while ago, NICE went from being the National Institute for Clinical Excellence to the National Institute for Health and Care Excellence. And those two changes were a good thing. They were intended to bring long-term care and medical care together. But it's not the whole story. The biggest source of support for older people with care needs is actually not DHSC, it's the Department for Work and Pensions. Far more people receive attendance allowance, DLA, disability additions to pension credit, etc., than receive social care via local authority funding. So the way the institutions of policy is set up don't reflect these kind of connections that we see in this sort of research. A second aspect of this joined up policy issue is that impact assessments, which have become an important aspect of policy making, perhaps don't do the job. As far as I can see, there was no impact assessment for equalisation of state pension ages between men and women, or at least I haven't been able to find one. However, there is an impact assessment for the rise in state pension age from 66 to 67, linked to the Pensions Act of 2014. And that too will have a big impact on informal care, one would expect. The impact assessment makes no mention of any form of care at all. So there is still a very tight limit on the breadth of impact assessments. And particularly worrying is the implicit assumption in a lot of the impact assessments carried out by government that unpaid work in formal care is essentially of no value. So all the emphasis really goes on getting people into paid work, and it fails to recognise adequately that informal care is unpaid work, which is extremely important because the whole care system could not operate without it. Further problems in policy are, well, mental health itself is a long-standing difficulty with public policy. For example, there is a low rate of receipt of things like disability benefit and care services for mental illness. So it's hard to be optimistic about the future support for the people identified by Kelly and her co-authors as suffering particularly badly in mental health terms from the COVID-19 lockdowns. Finally, there is quite a difficulty in generalizing the policy processes that we do have. For example, I work quite a lot on stuff at the moment that's relevant to what NICE does. NICE appraisals are individual based. They look at cost effectiveness of various interventions with outcome measures based on instruments like EQ5D, reflecting the outcome for the individual who receives the intervention. Now, the problem with social care policy is that it's necessarily family-based, if there is a family there. So informal care will, provided it's available, will almost always be involved in social care issues, which means there is necessarily more than just the recipient of the care involved. The other thing about social care policy is that because people with disabilities typically receive or may receive cash benefits via the Department of Work and Pensions, the cash benefit system is also involved. And NICE appraisals, the sort of appraisals we're used to on the medical front, simply don't have that aspect to them. So there's quite a big gulf to be crossed to bring the sort of social care policy problem within the traditional medical NICE type appraisal system. I don't have any solutions to these problems, but problems they are, and they need to be borne in mind. And I'll stop there.